My name is Winston Kim. I'm a consultant orthopedic surgeon. I'm a specialist in hip and knee surgery. My practice is focused on arthritic conditions of the hip and knee and the after effects of sports injury. Robot-assisted Mako joint replacement surgery combines 3D technology with CT imaging. This allows the surgeon to construct a surgical plan that is tailored to that individual patient. So what this means is patient-specific implant positioning, which is individualized to the patient in terms of the size, the anatomy, the alignment of the joint, which is different for all of us. During surgery, sensors are placed around the joint, which allows the software to detect the joint in 3 dimensions. What happens is that the surgical arm enters the field, the surgical field, and is able to make cuts that are precise to fractions of millimeters. It preserves the soft tissues around the joint and make cuts that are precise, preserving and conserving bone. And what that means and what that should translate into is less pain for the patient after surgery, less blood loss because of the accuracy and precision of the bone cuts and the absence of soft tissue releases that are necessary because of how precise it is. It is associated with quicker return to work, quicker return to full function. It should also translate into longer lasting joints and joints that are more natural or normal feeling. The robot arm allows the surgeon to guide the cuts that are made. So the robot arm is an assistant to the surgeon and guides the surgeon in relation to making cuts and preserving the soft tissues around the joint. In conventional total joint replacement surgery, the bony cuts are made based on the surgeon's training and expertise. In Mako joint replacement surgery, far more information is available to the surgeon that was not previously available. So what this means is that the soft tissues are balanced throughout the range of movement, whilst ensuring the stability of the joint and maintaining the alignment of the joint throughout the range of movement in a way that is far more precise and more accurate than was previously possible with the conventional joint replacement surgery. Certainly in my experience, the technology has given me far more confidence in the technical approach to surgery. So I don't rely on x-rays after surgery to know that I have done a technically optimized or perfect operation, because that information is available to me at the time of operation. Spire Manchester has taken the lead in developing Mako robot-assisted joint replacements, both of the hip and knee. It has shown real leadership in developing this technology with surgeons here. The feedback I have from patients is that they're very happy with the care that they receive here at Spire Manchester.